This is Abia COVID-19 update.
Abia COVID-19 update.
So the Presidential Task Force on COVID-19 yesterday announced that 3 out of the numerous claims of COVID-19 herbal cure have been identified and forwarded to relevant authorities for further investigation and validation. Now, the chairman of the PTF, that's Boss Mustafa, who is also the secretary to the federal government, made that announcement yesterday and said that the validation was made by the Federal Ministry of Health after holding a virtual meeting with Nigerian researchers and scientists. Now, he noted that the decision to meet with the researchers was also prompted by the incidents of mysterious deaths in Kano and some other cities. He added that efforts are equally being made to meet inventors of locally fabricated COVID-19 equipment. The Presidential Task Force on COVID-19 also reacted to reports that schools across the country are going to reopen on the 8th of June 2020 amid the coronavirus pandemic. Well, the Minister of State for Education, Emeka Nwajuiba, who is a member of the PTF, that's the Presidential Task Force on COVID-19, noted that the reports are false, as the federal government is yet to decide on when schools would reopen. He, however, explained that while it is currently not safe to reopen schools, plans are being made to see how the system can keep running despite the pandemic. Welcome to the program. Today, being 28th day in the month of May 2020. This is Abia State COVID-19 update, the 4th edition for the week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as Abia State Governor Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. The program is running simultaneously on several radio stations in the state every weekday, Mondays through Fridays, live on BCA 88.1 FM, Flow 94.9 FM. Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Now let's do the figures. As of 10:40 a.m. today, being Thursday, the 20th day in the month of May 2020, globally there are 5,807,149 infections of coronavirus that have been recorded, leading to the deaths of 359,807 people. 2,510,000 people, 510,388. I take that again, 2,510,388 people have recovered globally. Now, breaking it down to Nigeria, 389 new confirmed cases of COVID-19 in the country were confirmed yesterday, bringing the new tally of the confirmed infections in the country to 8,733. Now, the update is the highest daily figure so far reported since the beginning of this outbreak in Nigeria, 389. Also, Kogi State recorded its first cases of the disease yesterday, and this implies that 35 states of the Federal Capital Territory 35 states and Abuja have now reported at least a case of the disease. Only one state in the country, Cross River, is yet to record any case. Now, there was a decline in the number of deaths recorded yesterday, as 5 deaths were recorded from the virus, bringing the total number of confirmed deaths from the virus to 254. Now, till date, 8,733 cases have been confirmed. 2,501 cases have been discharged, while 254 deaths have been recorded in 35 states and the Federal Capital Territory. Also, 2 new cases of COVID-19 were recorded in Abia State yesterday. So Those are the figures. It is very important that as we highlight some of the figures, these figures, it is not for fun. It is for you to keep staying safe. Coronavirus is very real. Coronavirus is real. So keep staying safe. Ensure you adhere to the precautionary measures that we read every day. We tell you to stay away from the next person to at least 2 meters. That's about 6 feet. And of course, making use of your hand sanitizers frequently, it's very important. And of course, washing your hands and with hands with soap and water frequently. Now this morning, we're joined by the lead resident doctor at Amachara Isolation Center. That's one of the facilities keeping the COVID-19 patients in Abia State this morning. The lead resident doctor at that facility, Dr. Stanley Okeruru, joining us this morning on the program. On the phone anyways. Good morning to you, doctor.
Good morning to you.
Glad to have you join us this morning, and
thank you very much.
You're staying safe.
Yes.
Right.
We are trying our best to protect ourselves.
You're welcome. And how are the patients doing there?
Oh, glory to God. They are doing well. We are trying our best, and they are really appreciative of that fact.
All right,
I think most of them are fine this morning.
Oh, that's wonderful. Could you confirm confirm the number of patients in Amachara Isolation Center?
Okay. Currently, there are supposed to be 5 patients. We're expecting 2 female patients to join them today. However, over the I think a few days ago we discharged 2, so they are left with 3 male patients, and we're expecting to receive 2 this morning.
Okay. So the number of discharged patients again. I didn't
from
get that.
Amachara Isolation Center.
Yes.
From the beginning there were 5.
Okay.
2 has just been discharged. Then we're expecting 2. As if you followed the news yesterday, NCDC indicated that Abia has 2 more cases. Yes, those 2 we're expecting them today.
All right. Can you give us a general medical history of the existing patients?
I think all of them, 3 of them are returnees from Lagos.
Okay.
The 2 discharged are residents in Abia State. I think most of them had contact. Then all of them are stable. Only a few have some comorbidities. There's one with hypertension or so, but I think they are all fine. Yeah.
Interesting. We want to also know the condition of the patients and how close are some of them to full recovery. It's very important. Their recovery is what we are praying for.
Yes. In fact, for the 3 that are there, hopefully very soon they will also be discharged because they've been receiving their proper treatment, which we may not be able to disclose. And by God's grace, in the next few days they should be discharged because they are very fine now. Most of the symptoms they presented with have subsided. The sore throat, like some of them that had sore throat, some that had some fever and some other symptoms. The symptoms have subsided, so we're waiting for the final results. Then by God's grace we'll discharge them. So by and large, I think we're winning the battle and they're doing well. Yeah.
Now, for those that are still COVID-19 negative and are not staying safe, I don't know what will be your advice to them this morning.
Okay, those COVID-19 negative, if they don't want to come and join those in isolation, I think it would be best for them to protect themselves. Everybody should protect themselves. COVID-19 is real. It is real. We have patients at isolation center. I happen to be one of the doctors who manage these patients. We have some consultants also coming around to manage these patients. So COVID-19 is real, and Abia State is not an exemption. We have cases in Abia, and in fact, we are still doing contact tracing. So, and the fear is that anybody with COVID-19, not everybody presents with symptoms. So you may contract it from somebody who doesn't have symptoms, but the person actually has the disease. So it is of the best interest of everyone to protect yourself. Wash your hands regularly. Wear your face mask when you are going out. The benefit of face masks, is that you're not just protecting yourself, you're also protecting the next person to you. Because if you have it, when you produce those droplets, because of the face mask, they get trapped on the face mask. So it is advisable that as a matter of urgency and as a matter of as a must, everybody going out, once you're stepping out of your door to go anywhere, wear your face mask. Wear your face mask, because you are a dangerous person to another person if you are not wearing face mask. You are a dangerous person, as it were, to every other person around you when you are not wearing face mask. So because of the other contacts, the surfaces touching and the rest, you need to sanitize your hands frequently. And as soon as you get a running water, wash your hands with soap and water, and soap and water, of course, to keep your hands free of the coronavirus that infects and causes this COVID-19 disease. Yeah.
All right, doctor, I want you to paint a picture of what the isolation center looks like. And of course, if you have a positive patient, what the patient will go through. Being stopped from family visits, visit from family members, and some other pictures. I would like people to know about this morning, so that at least that will make someone conscious of the fact that we have COVID-19 and it is real.
Okay. From beginning, once you're a contact, or because one of those patients that come, we ask them to write down the names of people they've had contact with. And once a person is tested positive, we send some security and the epidemiologists, they go to bring the person to isolation center. And when the person comes, the person is taken into the isolation center, where he can't see his relatives, he can't see anybody apart from the medical personnel who comes in when there's need, or when to serve medications to the patient, to see the patient. So it's an enclosed environment, just like being in a prison. However, you make it a little comfortable for them. Truly, it's quite comfortable. Abia State government has tried to a great extent. The current isolation center at Amachara has about 11 beds. It was 10 initially, but we added one bed, making it 11. There's another structure opposite it that has about 100 beds. Then we have a holding area which is being built. Then at about 50 beds. So when anybody is positive, if he's being brought into the isolation center, and once the person comes in, he doesn't come out. He doesn't interact with anybody. He's isolated, meaning that he has the disease and he's kept in a concealed environment so that he will not continue spreading the disease to others. The only thing that happens is because of is that we give them food as at when due, maybe morning, afternoon, and night.
I was going to ask you about the welfare for the patients before we go straight to your welfare. Normally, for example, if I do have a malaria and I'm admitted to a hospital, I would have my family members visit me and bring food and some other things I need from my house. So how do you manage the cases of those patients there?
Yes, COVID is different. No relative is permitted to come and see you. Even if they have something they want to give you, we encourage that they take away. For example, if they bring a food flask, we can't return it to you. We have to burn it. So we encourage them, if they want to even bring something, they have to take away, but they can't see the patient. So it's while the doctors and nurses are going inside the ward to see the patient, we take that food or that material being brought by the parents or the relatives of the patient to the patient. So the patient doesn't have access or have free interaction with the patient except over the phone. So it's like a secluded life. It's not really interesting at times. But just that sometimes because we come in, we gist with them and they gist among themselves. They play Ludo for recreation purposes. They watch television, but it's not really, they don't have contact with other patients. Like the way if you have malaria, somebody comes to visit you, you can request for anything. You can walk outside the ward. This one, they can't come outside. They can't walk. They can't be free to receive fresh air. They only receive the air condition that is in the room where they are isolated. So it's a period. It's a 1, 2, 3 weeks of isolation, and there's no contact with any other person except from the managing physicians and nurses.
It's only important that when you're kept in such an isolation facility, you have some basic social amenities like the pipe bomb water running 24/7 and also the electricity working and functional. How about those social amenities there?
Oh, the other state government, like I said, have tried very well. There's a borehole and there's water always available. They have hot water, they have cold water. If they want to take their bath, they have a kettle they can use to boil hot water, and they have cold water, they have running water, they have drinking water being brought to them. The light is also very much available. When PHCN is off, there's a lister who supplies light. So they have light almost all through the day, and in fact every night. So those basic social amenity, water, light, food are available for the patients while they are inside there. The only thing is the restriction of movement.
Okay, doctor, just a moment now. We need to take a break. When we return, I would like to take you on your welfare. It's also very important as we've been focusing on the patients. All right, it is still Abia State COVID-19 update, the fourth edition for this week. It is live on several radio stations in this state, in Abia State, God's own state. And of course, we've been speaking with the lead resident doctor at the Amachara Isolation Center, Dr. Stanley Okeruru. The Amachara Isolation Center is actually one of the isolation facilities that we have here in Abia State.
This is Abia COVID-19 update.
Abia COVID-19 update.
It is still Abia State COVID-19 update, the fourth edition for the week, right here today being the 20th day in the month of May 2020, and we're live on BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. Now let's get back to the conversation today. We've been talking to the lead resident doctor at one of the isolation centers there at Amachara Isolation Center, Dr. Stanley Okeruru. And doctor, I'm very, very concerned about your welfare. It is very important. Please, can you confirm whether the government has been prompt in the upkeep of your colleagues who are bridging the gap for us?
Yes. The number of doctors there, please, I didn't get your question.
I want to know if the government has been prompt in the upkeep of your colleagues who are bridging the gap for us.
Yes. The government are really trying. They give us accommodation and they feed us 3 times a day, and also they pay us for our services. So I think most of us, the doctors, the nurses, the other support staffs like the cleaners, the other support staff that take care of the rewiring, the plumbing, and the rest, they're taking care of every one of us, feeding us 3 times a day, and they also give us a decent accommodation where we lay our head at the end of each day work.
Do you go home?
They're trying.
Do you go home?
No. Since I commenced this work, I've not seen any of my family member since I commenced this work, because it's quite risky to expose my family to the COVID-19 if I'm infected, or if I have any of my wares infected with COVID-19. So I have not seen any of my family member since I started attending to COVID-19 patients.
Interesting. So what has been the experience like? You have a wife, you have your kids, and you've not been at home. How do you feel?
It's not really funny not being with your family for such a long time. Not just me, every one of us, the consultants, the nurses, the cleaners, and everybody. No, it's not funny that you've not seen your family for such a long time.
But do you get in touch with them to maybe FaceTime on the social media, WhatsApp,
on social media, video calls? You know, where you do video calls, you show them around. You tell them this is where I am. Or when you're on PPE, somebody calls you, holds the phone and take a picture and show them this is what I'm doing. And you know, because of the work and the danger of the work, I can't come home at this moment. So they get to understand with you and pray along with you as well, because of course family loves loves you so much. So we keep in touch with them over the phone and with video calls. So that's how we communicate with them. But since the onset of seeing patients, we've not gone home, just to protect our families.
Okay, Dr. Stanley, I want you to paint a picture of you leaving that your temporary accommodation now, going to see a patient now. How do you go about it? I want you to paint that picture of you when you're putting on your PPE. You approach the isolation center, maybe the male ward or the female ward.
Okay. Whenever we have timing for going in to see the patient, except on emergency cases where the patient calls on you for something else, you make sure you ease yourself of every form of stress. You go and pee, you go and ease yourself, you eat if you need to eat because of the time you need to spend.
Why do you need to ease yourself?
Because once you're on PPE, you can't ease yourself again. You can't do anything until you are done with that patient. Then you don't need such tension of being pressed while seeing a patient. So you need to relax, empty your bladder before you wear. Even if you're not feeling pressed, go to the toilet and make sure you empty whatever is there. But sometimes you take up to 1 hour, 30 minutes, 2 hours, taking vital signs for the patient, taking history of the patient. So you need to be free of every load, of every burden that is not necessary to be in there with you. So then, of course, if you need to eat so that you will not go hypoglycemic, meaning that you will not go shortage of sugar in your blood, you take something before you enter. So when you wear your PPE, you need to be covered fully. In fact, as soon as you dress up with your PPE, you're expected to enter because you start sweating already inside. It's quite hot wearing that PPE. It's not a pleasant, even in the presence of air condition, you'll be sweating inside. You'll be drenched. So we now go inside, sanitize. As we are wearing it, we're sanitizing. There are procedures, as we've been trained by NCDC, of wearing the PPE. You don't just wear it anyhow. And there are procedures of removing it because of trying to minimize the risk of getting infected. So by the time you enter, we see the patient. After each patient, you sanitize your hand so that you not pack one thing from one patient to another. So after seeing each patient, we sanitize until we finish with all the patients. And that period, you keep on sweating inside. So by the time you're coming out and pulling your PPE, you discover that the scrub, there's what we call scrub, the inner wear, the clothes you're wearing inside, which looks like a theater wear, is drenched. You are very drenched because of the heat that the PPE produces inside, especially the thicker PPE, the one that looks like orange color. So you get to sweat so much inside, and when you come out, you follow the normal procedures outlined by as we're trained by NCDC to remove that PPE to avoid yourself being infected.
Interesting. Can the PPE be reused?
Oh, no. You can't reuse the PPE because it's already contaminated. So what we do is after each entrance, we burn their support staff who take them and we put it in a biohazard bag, and eventually they are burned off. In a position, yes.
We have limited time now, but I will see if I can take one or two reactions on the phone lines before we wrap up this conversation this morning on the program Abia State COVID-19 update. 0808 182 6949 0811 605 2949. You can also drop messages on 0906 510 8289. Let's see. Hello, good morning to you. Hello. Yes, good morning.
Good morning.
You're welcome. What's your name?
Yeah, my name is Ambassador Kenneth. I'm calling from Mumbai.
You're welcome, Ambassador. You have 30 seconds because of our time.
My own is to thank them because I don't know that this thing was like this. So look at all the precautions that have been taken. Well, what I will tell him is that forget about the money that is given to you. God will pay you and reward you, and your family will meet them better than you get them in Jesus' name.
All right, thank you very much. Let's see if we can get more reactions. 0811 605 2949 0808 182 6949. Hello, good morning. Good morning. Okay, I'm sorry. I will have to let you go. The network there is not friendly. Hello, good morning. All right, we have to wrap up the program this morning. Thank you very much.
Okay,
I want
please,
to, yes.
before we wrap up, just to give you a correct detail about the number of patients we have in isolation, please. I forgot someone, when you see this patient.
Yes.
Now, we initially from onset, we had 2 patients at FMC. One was discharged, I think the second one has been discharged. Then at Amachara, we started with 5. We discharged 2. We had 3 remaining. One came in yesterday, so they are 4, and we're expecting 2 that I think they should have joined by now today. So that may eventually be 6 at the isolation center.
All right,
so get it right.
Okay.
3 plus 1, which is 4 as
Yes.
of yesterday.
At
Then
the
today 2 will
Amachara
be
Isolation
added.
Center.
Yes, at the
All right.
Amachara Isolation Center, 2 will be added, making it about 6. Thank
All
you
right,
very much.
thank you very much, Dr. Stanley Okeruru, for your time this morning. We will definitely get back to you to see how the patients are doing there.
Okay.
Thank
They're
you.
doing well. They're doing well.
Thank you very much. That's how far we can go this morning on Abia State COVID-19 update. Many thanks to the partnering stations, Flow FM, BCA FM, Vision Africa, Buzz FM, and Real FM. My name is Michael Oni.
This is Abia COVID-19 update.
Abia COVID-19 update.